Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Stony Brook Southampton Hospital to help you sort through what's going on with COVID-19 in our communities and all across the region. And of course, we want to hear from you. This is a call-in show, so call us, 516-393-1800. Well, 75 days after New York had its first case of the coronavirus, 4 upstate regions will begin to reopen tomorrow, but Long Island, which is being treated as one region, both counties, well, we'll have to wait. Combined, the 2 counties still only meet 5 of the 7 benchmarks that's needed to begin this reopening process. Governor Cuomo issued a stern warning today about unpausing the state. He cautioned, do not underestimate this virus. It has beaten us at every turn. That's his words. There are now more than 343,000 confirmed cases statewide. Look at those numbers. More than 76,000 of those cases right here on Long Island. Nassau Executive Laura Kern says the rate of infection is slowing. Now, she says the number of people contracting the virus, it's at a new low. And Suffolk Executive Steve Bellone says a high percentage of new cases, they're being reported from the hotspot testing sites in minority neighborhoods. And Governor Cuomo says all arrows are pointed in the right direction, but the number of lives lost, that's still terrible and tragic. Those are his words. State's official death toll, that's risen to more than 22,000. Those aren't just numbers, those are lives. A little more than 3,700 Nassau and Suffolk residents lost their lives to the coronavirus. All right, let's get right to our conversation. Joining us tonight, Dr. Rajeev Fernando, an infectious disease specialist, Stony Brook Southampton Hospital. You also work with Doctors Without Borders. You've traveled to China to actually study the coronavirus, and you've been on the show before. I thank you so much for everything you do. You're working tirelessly, and then you join our show to give us great advice. Let me ask you, just to start off, how are you and your colleagues holding up?
We're doing well. Things are getting better, but it's very important that we continue doing the social distancing that we're doing. But things are starting to slow down, and we're doing better. Thank you for asking.
Well, yeah, and as the numbers, the governor is giving upbeat, words, and we see the numbers going down, and we seem to be on the right path. But you and I were talking before the show, and we also have to look in the future because there could potentially be a second wave, right?
Yes, absolutely, Stone. And so what happens right now, I think Long Island is moving in the right direction. A week ago, we had fulfilled only 2 of those criteria, but as of today, we're at 5 of those criteria. So I think Long Island will continue to move forward, but until then, we need to aggressively social distance. My real concern is a possibility of a second wave, and that's why I advise people in Long Island to continue what you're doing. Aggressive social distancing, hand hygiene, and of course surgical masks. We need to continue doing this. If we don't, we may experience a second wave, and some of the consequences I think out of having a second wave is, the healthcare system, which is already pretty fragile, will be overwhelmed and overburdened again. And healthcare professionals, we're always there on the front lines for our patients, but sometimes the mind is willing, but the flesh isn't. So there'll be natural fatigue going on with the healthcare workers. And the other thing is, if a second wave happens, you're going to see a worsening economic situation. So we're going to sink even deeper into an economic crisis. So those are 2 big reasons that we need to support the system to avoid going into the second wave. Okay,
let's get some of the callers in right now. Margaret from Massapequa. Margaret, are you there?
Yes.
What's your question tonight?
Good evening, doctor. My question is it safe or advisable to drive in a car with a friend if both are wearing just a simple mask, not the N95, and obviously not able to maintain the 6-foot social distances?
I think we lost her there. Doctor?
Well, yeah, I can answer that question. Margaret, thank you for calling. And firstly, I'd like to say, of course, wearing a surgical mask is necessary. There's no indication for an N95 in the community at this point. But let's move on to the second part of your question. And really, the social distancing, you fulfilled one criteria by wearing a surgical mask, but the social distancing of 6 feet is not applicable over here. So that still poses a risk. I don't think it's a good idea at this time. Remember, you're sitting very close to each other. Touching fomites in front of you, the parts of the car, you could still transmit virus. So great question. You fulfilled one of the criteria, but not fulfilling all 3. So I'd hold off for now.
Okay. How about Davey from West Babylon?
Hi, good evening, doctor. My question is my 11-year-old grandson was recently diagnosed with COVID toes. However, they tested him and he tested negative for the COVID virus. What are your thoughts on that?
Yeah, it's a great question. We feel the COVID toes are probably in a second phase where the patient has actually gone through the illness and moving further in the illness. That's when we're trying to see COVID toes. Now, I reported on the rashes that we've seen about a month ago, but we feel it's in the second phase, and that's why when you do a nasal swab, it may come back negative. We feel it's in the second phase, and that's why a lot of our patients I've tested as well are negative. But it's certainly in this day and age, in the time that we're in, we certainly should think of this dark toe, which is painful, as a complication of COVID.
Okay. What about Lenore from Franklin Square?
Hi, thank you for taking my call. I have a friend that has COVID-19. She was diagnosed on March 17th and has tested positive 3 more times up till today. How is that possible, and is this something that we all should be worried about? And do we still need to quarantine?
Yeah, great question, Lenore. So there are 3 possibilities in this. One is you could still be infected, which I feel is rare. But if you are having symptoms, fevers, chills, shortness of breath, cough, along with this positive test in the nose, you're still infected. That's one thing. The second perspective is you could just be a carrier, which means your clinical illness has disappeared, but the virus still persists in your nose, and that could be an asymptomatic, what we call colonization, which means the virus is present in the nose, but it's not really causing any disease. The third possibility over here is sometimes the test that we do to check for COVID-19 in the nose is a very, very sensitive test, which means a positive test will not distinguish whether you have a single virion, a single SARS-CoV-2, or you have 5,000 SARS-CoV-2. It's a very sensitive test, and what we're seeing is we feel it's dead fragments of the virus that are still left after the disease. The virus is beaten, and there's some dead fragments that we find over there, and I think that's certainly a possibility. So those are the 3 possibilities. Now, we know from other respiratory viruses, traditionally influenza, the test still comes up positive, 5 to 7 days during the illness, but we haven't seen too many situations where influenza continues to be positive. With COVID-19, we're still learning about the virus. I tell you the number of times I've seen this exact clinical situation, and you can answer that question by just the 3 answers that we've just discussed.
All right. What about Maria from Glen Cove? Maria?
Hi, good evening, doctor. Thank you for taking my call. My question is, what do you know about the plasma donations from recovered COVID patients with antibodies being used for a cure, treatment, or vaccine, and is it being done proactively?
Absolutely. So now we have data showing that, firstly, the plasma convalescent plasma is totally safe. We've seen less than 1% side effects, some transfusion-related reactions, but now we know it's completely safe. And as a matter of fact, we're in full swing with plasma. As a matter of fact, Stony Brook Southampton and Stony Brook University are enrolling patients in trials, so you can reach out to them and go from there. It's still very early to say whether this actually works, but in theory, it's a fantastic situation where you give antibodies to a patient who's actively infected, and in that case, we can help neutralize the virus. So I think a lot more data to come out, but you can certainly reach out to Stony Brook University and Stony Brook Southampton for enrolling in trials.
Okay, let's try to squeeze Stan from Belmore in. Stan, you there?
Hi.
What's your question?
Hi. Thank you for taking my question. We hunker down very well in our house, but on occasion, if I have a repairman come in and go down to the boiler, we stay far away from it. And we also have a woman who comes in to clean time to time, but we're never near her. We either go outside or go far away in another room. Is that okay?
Yeah, that's perfectly fine. Make sure that when somebody else comes to your apartment or your house, I say apartment because they still live in the city. It's beautiful on Long Island and houses over here. But when they come in, make sure you have hand sanitizer at the door itself. Make sure he or she sanitizes and go from there. Perfectly safe as long as the social distancing criteria is maintained. Enjoy the sun until the work's over.
Okay, we're going to take a real quick break, but when I come back, I want to ask you about a recent study I was reading about. We've been reporting on it as well, about people when they're speaking loudly for at least a minute, that the coronavirus can actually live in the air for about 8 minutes. We'll talk. I'll have a kind of comment on that when we come back from the break. But we're going to take a real quick break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. Call us with your questions. The number right there on the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Rajeev Fernando, an infectious disease specialist from Stony Brook Southampton Hospital. You have your hands in a lot of different pots. You also, Doctors Without Borders, you've been to China to study the virus. You do a lot of work. Before the break, I was asking about, it was actually a couple of studies. One involved Northwell Health patients. These were hospitalized COVID-19 patients, and about a third of them had AKI, that's acute kidney infections. And the other one was a study that in a controlled environment, if someone spoke loudly for at least a minute, the virus seems to be able to live in the air for up to 8 minutes. I was wondering if you can just comment on those.
Sure, let's take it one step at a time. So the first study about AKI, it's a very well documented study, great study out of Northwell. But let me take this into perspective over here. I think people think of COVID-19 exclusively as a lung disease, but I'm here to tell you it's more than the lung. It really affects you from head to toe. Let's actually start from head to toe. We have strokes, then we have infections in the nasopharynx, going down further into pneumonia, going down to the gastrointestinal tract where it causes severe diarrhea. Moving onto the skin, it causes rashes. Moving onto the kidney, acute kidney disease, like you mentioned. And then moving further down, one of our callers discussed about COVID-19 toes. So it really is a multi-system involvement. So it's very important to recognize these signs. It's just not the lung disease. It's just not shortness of breath. So it's very important to identify these syndromes when they're coming in. We don't know whether these are long-term side effects, and that's what I really worried about. Certain areas like the heart, after having a heart attack, is there going to be permanent scarring on the cardiac tissue? There's just so much we need to learn about, but definitely, like I discussed, it's very important to know that this is a multi-system involvement, and we're still learning more about this virus.
Okay, let's try to get a couple of callers in still. Kathy, are you there?
Yes, I am.
What's your question?
Thanks for taking my call. Hi. If a person is more than 6 feet away from you and is smoking a cigar or a cigarette, and they're COVID positive, and you breathe in that smoke by just passing by, is it possible to be transmitted to you?
Yeah, good question, Kathy. And there's really no data on that. It's absolutely, as long as you're 6 feet apart, smoking a cigarette should not actually cause spread of virus. And I'll go back to Stone's question, which I failed to answer before, about the study where that the virus can actually stay alive for about 8 minutes, some scanty data about 14 minutes. But we know the virus actually goes like a piggyback, on a piggyback ride. When you're secreting these respiratory droplets, the virus travels along with it. So we're seeing studies, which it's a pretty good study actually that I read. I still want to wait for more to come out, but clearly we see that it can stay alive for 8 minutes. And with regards to loud talking, first of all, I think we should avoid loud talkers in general, but just off the bat. But anyway, with regards to loud talking, we know that there are many more virions actually spread. So we see these situations like it's happened in restaurants in China, it's happened in call centers, in South Korea. So we do know that loud talking actually has an increased virion count. So really, it's not a good time to actually tell the person to lower their voice.
Yeah, lower your voice. Be calm.
Be calm.
All right, let's try to get Bruce in. Bruce, you there?
Yes, I'm here.
All right, what's your question tonight?
Thank you, doctor, for helping us here in Long Island. We have a family in New Jersey. We haven't seen our children, our grandchildren, for 2-3 months. And we're wondering, they've been secluded, we've been secluded, whether or not it's safe for them to travel here and stay with us for a week or so.
Yeah, that's a brilliant question, because we do know that kids are carriers. What makes it difficult is they don't always manifest the signs, the classic signs and symptoms of COVID. We do know there's a new multi-system inflammatory disorder, which we'll talk about the next episode when Stone invites me again. You will be inviting me again, right?
Absolutely.
Stone? Thank you so much. So that's how we hustle. And
if we haven't scared you away yet, we'll
I'm game. There's nothing more important to me than helping the community and giving them accurate information. So thank you again for having me. But in theory, if you really, the children have been at home, they've been social distanced, and you continue to do that right now, like schools have been out, there's no risk factors, as long as you continue the trifecta, which I always mention, it's reasonable for them to come home. You can take it to another extent and do a nose PCR. I don't think that's applicable to see whether they're infected or not. That's probably an overkill, but as long as they mention the social distancing, and like you said, they've not been out and exposed, I don't think it's unreasonable. Masks, of course.
Okay. I know when our next caller is, I don't know if we have time to have Stephanie do it, but let me just ask her question for her. She said her neighbor tested positive. Is it safe for her to go for a walk without a mask, but still social distancing if she's done a 14-day quarantine?
That's what the guidelines say right now. 14-day quarantine, that's what the guidance is. But I'm skeptical because we're still learning more and more about the virus. And I think it's still a good idea to wear a mask, keep everyone safe. Where, like I said, the virus is always one step ahead of us. So whatever we're doing, the virus is always ahead of us, a step ahead of us. So I still think it's safer to wear a mask. And we should just develop that habit of wearing a mask right now. I know it's very difficult for a lot of people, but we should just accept this as a norm for the next couple of months. Remember, pandemic times where the world has not seen anything like this for 100 years, really. Yeah. So these are important times, and I urge all of you to wear masks as well.
All right. Well, Dr. Fernando, thank you so much for your time. You're already booked for coming back, so you're in now. Thank you so much, and thank you for the viewers. We'll see you tomorrow night at 7.